One of the most talked about topics in infants and babies' health right now is tongue ties. And now, more than ever, it's getting the blame for countless pediatric health conditions. And because of this, there are so many questions that surround this topic. So today, we're tackling tongue ties. We're going to break down the science between your baby's tongue tie and not just the potential difficulties with breastfeeding, speech, and neurodevelopment, but also going deeper and investigating why we're seeing so many of them in practice today and what the true root cause of all this trouble might just be. So, parents, breastfeeding moms especially, if you're wondering, number one, if your baby has a tongue tie, and why the different providers that you're seeing may have different opinions on the severity. And number two, is this the reason that they're having trouble latching, that they're nursing uncomfortably, that they may not be gaining weight in the right order or the right speed, if they're experiencing colic, reflux, or an overall discomfort? To talk about potential causes of things like tongue tie, we have to roll it back and look at fetal development as a whole. And this looks at the connection between prenatal development, the birth process, and the prevalence of tongue ties, and most importantly, give you the best care options and the best way to actively address things like tongue tie. I have the very great fortune of having a relationship with a group of practitioners that work with feeding therapy and do a great job at identifying, quantifying, and understanding tongue ties. So we've been able to learn a lot from each other and also work very synergistically. You could say we got some synergy. But to bring it home, if you've followed us this far, you know that my wife Haley and I have just welcomed our first son into the world, well, about 3.5 months ago. And being a practitioner in the pediatric space, I see a ton of kids. But I tell you what, when it's your own, it's a whole different story. Checking for things like vitals and a tongue tie, and is he crying, and is he doing this, and is he eating well, and is he eating enough? It is overwhelming, even to somebody who lives in this world and sees it all the time. So when Haley was working through feeding and latching and making sure that Benny was comfortable as he was figuring things out just as well as she was, every little thing put us on high alert. We wanted to figure out if anything was wrong. Are things going right? I don't know if things are going right. This is our first baby. We had to take a step back and say, you know what? From an outside perspective, we look at this every day. It's a very calm thing. But in the moment, it gets a little crazy. And the first thing when we are talking to different people about, well, what was your experience here? This is how we're seeing things. Many people said, well, does he have a tongue tie? Did you look? And I tell you what, every time there's a could it be, the human instinct is to look it up. And the hard thing about looking things up is it always goes to whatever the worst thing in the world could be. So you go down this rabbit hole of, oh no. Luckily, we are not dealing with any of those things, but it just goes to show you that this is a topic that is, number one, very often talked about. Number two, on the forefront of many new parents' minds, especially mothers that are having, a little bit of time getting used to breastfeeding. So let's get into the meat and potatoes of it and talk about what is a tongue tie, what are some things that can contribute to it, and also, most importantly, what can you do as a parent to help your child get past it? Tongue tie is a condition where the little strip of tissue under the tongue that connects the tongue to the bottom floor of the mouth is too short, it restricts movement, and it reduces the function and mobility of the tongue. Now, this makes it difficult for a baby to breastfeed properly. It's going to make it difficult for them to latch and to nurse effectively. This condition may also go by the term of a TOT, TOT, or tethered oral tissue. I guess that's the cute way that they decide to give an acronym to a condition that's not very cute. And this can also pull in different tissues in the frenulum, that strip of tissue between the tongue and the floor of the mouth, with other connective tissues of the mouth and jaw itself. This lack of mobility, or the lack of the ability to move the tongue around. Some babies with a tongue tie have a difficult time opening their mouth all the way in order to get a good latch. And this leads to difficulties such as having difficulty attaching to the breast or staying attached in order to complete a full feed. The babies may seem unsettled or hungry all the time. The baby may not gain weight as quickly as they should. You may hear a clicking sound during feeding. Now, what's tough is some of these signs of tongue tie often mirror the signs of general colic or neurogastric distress in a child. So it's often difficult to delineate between the two, and most importantly, get to the root cause of what's going on with your child's nursing, eating, and sleep challenges. The $1 million question: is it tongue tie that's causing my baby to struggle, or is it something else? Well, to answer that question, get your shovels out, got to dig a little bit deeper into what's causing these things. When we're looking at traditional medical explanation, there's often an attribute into genetics. But again, digging deeper, I think there's more to the story. Some natural health providers will connect it to mutations in the MTHFR gene, which affects folate absorption. There are some studies that even suggest that increased folate intake, like in some prenatal vitamins, may play a role. As a neurologically focused pediatric chiropractor that looks at neurology and neurodevelopment and the development of a child and all these things together, we're going beyond these traditional approaches and we're looking at things like the soft tissues surrounding those areas and also nutrients. So here's the key. The tone of the nervous system is going to heavily influence the tone of the muscles and the soft tissues of that lower jaw. And if the mom and the baby's nervous system is stuck in that fight or flight, sympathetic, stress stuck on mode, it can affect the frenulum, the mouth, and the jaw, even before the baby's born. And while physiology and chemistry matter a ton, true health and development, they begin with the nervous system. That nervous system is key to understanding the environment and coordinating behavior of all the cells of the body. Now, when we apply this to tongue ties, it becomes a little bit more clear on how these things mesh together. And ultimately, the answer is that tongue ties are truly a combination of a bunch of different things thrown together. And like many conditions, when these are all thrown together, they create a perfect storm. To get back at talking about prenatal stress and TOTS, remember, tethered oral tissues, TOTS, it's so cute, but it's really not. This perfect storm often comes prenatally from an emotional fight or flight response originating in mom, felt in baby, and compounded with birth and delivery. Now, when babies have a stressful birth process, it comes in two ways. The first is misalignment or fixation of the vertebra, and that is biomechanical and musculoskeletal in nature. Now, this is also combined with stress in utero, and a neurological component arises during key points in the developmental process. Here's the thing. I'm not just pulling this out of a hat. If I was going to pull anything out of a hat, it'd be a rabbit, but I'm not a magician. There's a study done in 2015. It's published on PubMed. You can look at NCBI and check it out. Published in the Journal of the American Osteopathic Association. It was called Incidence of Somatic Dysfunction in Healthy Newborns. We're going to host a link on our blog post this week to this. So if you want to check it out, hop over to our website, check out this week's blog post. I will have this article linked. But if you don't care to go read it, I'll tell you the skinny on it. They found a whopping 99 out of 100, that's 99%, that's a lot, of healthy newborns did have some incidence of somatic dysfunction, aka misalignment and fixation stress. And this was found as a result of the birth process. Now, this causes what may be an already stuck cranial and oral system that developed in utero, remember that perfect storms of brewing, to be further twisted and torqued, and it puts even more pressure on baby's neuro-oral movements. So again, we already had the $1 million question. Here's the $2 million question. What do we do? After going through the gauntlet of the old Google and talking to providers that you trust and finding the right provider for you, many parents will elect to go under a tongue tie revision surgery by a pediatric holistic dentist. Now, here's the thing. This procedure is crucial for both short-term and long-term health, considering its effect on nutrition, neurological development, and emotional bonding. It's a big deal. They're a good thing. However, just like any medical procedure, there are some factors to consider when making this decision. If babies experience stress in utero, abnormal fetal positioning, or birth trauma, could the increased tension and thickness of the soft tissues be a proactive response to the entire neurological system? And herein lies the catch. If the tongue tie is surgically resolved without considering that underlying tension, then things may initially worsen instead of getting better immediately post-surgery. And this is where neurologically focused pediatric chiropractic comes in and shines. Without addressing that part of the nervous system in terms of why this tissue is behaving the way it does, then the original cause of that neuromuscular tone, even when that frenulum is released, it's still there. It's still tight. It's still tense. It's still dysfunctional. Now, take that and stack on a post surgical recovery, and it is not comfortable at all for these kiddos. It can be a lot to handle for these little ones. So, like I said, these surgical revisions can be a huge benefit short term and long term. But the other key takeaway from this is to make sure that the stress and tension in the nervous system, talking to this connective tissue of the lower part of the jaw, is assessed and evaluated by a neurologically focused pediatric chiropractor, this guy, before, during, and after the procedure is done. By unwinding the stress and the tension in the nervous system, it can assist in helping to better unwind the stress in the connective tissue after the revision. By doing this, we're working together to get the best outcomes in the short term and the long term for your child. Now, I know that navigating these waters is scary, it is complex, and there is just so much information out there that when you look at it at face value, it is completely overwhelming. But I want you to know I'm here to help, I'm here to teach, I'm here to grow with you. Again and again, we find that babies' tongue ties are made so much worse by moderate to severe tension and stress in that nervous system. If you take a peek at this insight scan right here, which is one of the ways that we're detecting this irritation and dysfunction within the nervous system, you can see big red bars at the top. Now, this is a scan of an infant who was already post-tongue tie revision. And the takeaway home here is that even though that connective tissue that was tethering the tongue to the bottom of the mouth had been surgically corrected, there was still tension in the system. And the thing that's extremely important when you're talking about the soft tissue in the bottom part of the jaw is it is very sensitive to irritation through the nervous system, especially at the top. We know that when a baby is born, they experience an immense amount of stress from a compressive nature in a normal vaginal birth, or if we're talking about an assisted birth, like a C-section, forceps, or vacuum, that compression becomes distraction. It becomes a completely different type of strain. Both of them can put a significant amount of irritation in the upper part of that child's nervous system. But it doesn't have to stay there forever. That's what we do. We get rid of this stuff. In this case, we were able to use this scan to dial into the exact location that this little baby was struggling neurologically. Now, the great thing about our insight scans is they are not invasive, they do not hurt, and they can be done in the arms of mom or dad. Okay, this one's been a doozy. So if you or your family is experiencing anything that we've just talked about today, if your little one has a tongue tie or is suspected of having a tongue tie, please reach out. We have an immense amount of resources to help exactly this. I'm here to help you. I'm here to help your family. I'm here to help your little ones. I can't wait to meet you. I can't wait to see you. I'll see you soon. Take care.